Greetings. Today I would like to introduce Dr. Mertens Innovations and our Acupressure Octopus line. This is a unique back pain support that combines mobility, acupressure, and posture support all in one product. For distributors and partners, this is a unique product that's going to broaden your portfolio and is loved by the customer. First of all, let me start by saying that back pain is a biopsychosocial phenomenon, which means that back pain is rarely just one thing. In reality, usually it's a combination of physical, biomechanical, and psychosocial factors. A patient might have poor posture, stress, muscle overload, which also could be accompanied by fear of movement, bad sleep, some changes on MRI all at the same time. That's why one simple explanation usually does not fit every patient. From the physical side, what we might encounter is disc changes, facet joint irritation, or facet joint arthrosis. From the biomechanical side, we can see poor alignment, forward-leaning posture, loss of lumbar lordosis, thoracic stiffness, or weakness in the back extensor muscles. And from the psychosomatic side, of course, the pain might become stronger when the patient is more stressed, might be inactive, worried, or even afraid to move. Modern low back pain literature shows this way of thinking, and it also supports active non-pharmacological care as first-line pain management for many patients. With this said, this is important for our product philosophy. The Acupressure Octopus covers all three phenomena and is a part of a broader conservative treatment strategy that supports movement, posture, local stimulation, and daily function. It's also important to say that the comforting sensation that the back brace provides whilst wearing it supports the feeling of relaxation. Important part of the Dr. Mertens philosophy is the 6-point principles. Here is point number 1. The first principle is movement. In spine care, this is the key question. Should we fix the patient or should we help them move better? In some emergency or unstable conditions, immobilization is key and the surgery is the answer. But actually, with non-emergency back pain, staying active is very important rather than prolonged rest. Modern evidence shows that advice to stay active and exercise-based approaches can reduce pain, especially in chronic low back pain. When people stop moving, the muscles obviously become weaker. The confidence also becomes lower, and the back pain cycle often becomes stronger. And this is why the Acupressure Octopus line was designed to be a dynamic arthrosis. The product is meant to support the back whilst moving. So basically, instead of stopping the body, it moves with the body. And this is a very important idea between this new philosophy where the movement is the key and the old philosophy that every painful back must be tightly fixed. The second principle is the tactile local mechanical influence. This means targeted mechanical contact with the painful or overloaded muscle zones. In simple terms, it's controlled local massage effect. And in the Acupressure Octopus line, it's the effect that's created by the acupressure elements, by the way, those are visible, that press into selected soft tissues around the spine. You can see that in different models, those elements are located in different places, thus stimulating that particular area. The idea is truly practical because when local tissues are overloaded, stiff, and painful, patients often report relief from touch-based methods such as massage, taping, or manual therapy. The Acupressure Octopus takes this principle and makes it wearable. With movement, the body gently moves against the acupressure elements again and again, thus creating the sensation and the massage effect. This repeated contact is intended to support the local circulation, reduce muscle tension, and of course create relaxing but active therapy effect. Principle number 3 is posture and sagittal balance. In clinical practice, many back pain patients are not only painful, they are also poorly aligned. So what's happening is that they lean forward, their lumbar curve becomes flatter, the thoracic kyphosis increases, and their muscles work harder just to keep them upright. And over time, this overload itself can become a major source of pain. It's also important that the recent research on paraspinal muscles shows that low back pain is often associated with poorer muscle quality, including more fatty infiltration and reduced function muscle area, especially in the multifidus region. And so this supports an important clinical idea. We should not look only at the disc, we should also look at the muscles. And also based on Dr. Mertens' 20-year of spine surgeon's practice, it's seen that more than 80% of the back pain is usually related to the muscles exactly. As I was saying, it is important that we look at the muscles that actually control the spine and the posture that the muscles are trying to hold. The acupressure octopus, on the other hand, is designed to support a more balanced posture without the rigid metal fixation. By guiding the body into a better alignment and by stimulating the extensor muscle zones, the brace can help the patient avoid staying in a collapsed forward posture for long periods. The fourth principle, which is very important, is the individual approach and individual adjustment of the brace. No two patients feel the pain in exactly the same way. Also, obviously, no two bodies are the same shape, height, and weight. Also, pain zones, tissue sensitivity, or even daily activity patterns, of course, differentiate. That is why fixed level of pressure does not necessarily work for all. The right amount of force for one patient might be too little or too much for another. This is a very important point that the acupressure octopus does allow, is this gradual zone-by-zone adjustment. The user can obviously change the tension in separate parts of the brace and actually find the comfortable level of acupressure. It must be added that this is especially important in the first days of use, when the body is only adapting. Once again, the goal is not the maximum force, but the goal is pleasant, controlled, and therapeutic contact that the patient can tolerate and actually continue to use. This is very important that it's used regularly. We recommend starting with 2 hours a day of wear, and then you can increase it gradually and see how it feels. Always listen to the body. So if the brace is adjustable, more comfortable, patients are more likely to use it in daily life, which is where the conservative treatment must actually work. This all is very crucial for long-term treatment. The fifth principle, very important, is to avoid impairment of abdominal organ function and breathing. As intra-abdominal pressure increases, diaphragm movement becomes restricted due to resistance from the abdominal cavity. And so what happens is, to compensate, intracostal muscles take on a greater role in breathing. Unfortunately, older patients using the classical stiff braces often report respiratory difficulties, as well as cardiac complaints due to the abdominal compression. Dr. Mertens' philosophy takes a different path. The design of our braces actually leaves an opening over the interior abdominal wall and uses narrow fastening mechanisms. And this aims to support the back without actually strongly compressing the abdomen. And the result is actually better comfort for breathing, easier movement, and less interference with daily activity, which is the key to a happy life, right? This principle is actually especially relevant for people who do things for a longer period of time, let's say sitting or walking or driving or maybe having the desk work, basically repeated daily use, because if the back brace feels like a cage, patients will not accept it. It becomes a realistic conservative treatment tool only if it actually supports the back while still feeling wearable and comfortable. And the sixth principle is to use the medication when actually needed. Medicines are important in back pain care, but they're not always the whole answer. Many patients, especially with chronic or recurrent pain, do not want to depend only on tablets. There might be different reasons. Some don't want to do that because they cannot tolerate them well. Some want to reduce the side effects. Others, such as breastfeeding mothers, might want to limit the intake of the medicine as much as possible. And obviously, this is where the non-drug conservative tools are valuable. So if movement, education, posture correction exercise, and local mechanical stimulation actually help reduce the symptoms, then medication may sometimes be used less. And this is not a promise that every patient is going to stop using the drugs. It's a more careful statement where conservative support works, the treatment burden might become smaller. And so when we put the 6 principles together, we get a clear treatment philosophy. So once again, it is a preserve the movement, give local mechanical input, improve posture, adjust the intensity to the individual, avoid abdominal compression, use medication carefully and only when needed. These are simple ideas, but together they make a different view on the back support. It is also important to say that you should take care of your back preventatively. And of course, the other side of this product of the back brace is that it treats the back. For example, in the rehabilitation process, it shortens the time of recovery. So now let me introduce you to the 3 models of the Acupressure Octopus. We have the 3 main back orthosis models. We have the lumbosacral model, which is intended for discomfort in the lower back and the sacral region. The high lumbar model covers a wider zone from the sacral and lumbar region upward towards the thoracolumbar transition and middle back. The thoracic shoulder model is designed for the thoracic region and shoulder area, including people with tension around the neck. Across the line, the common concept is the same. The brace does not aim to lock the spine. It aims to support the muscles, provide controlled acupressure, and help posture while preserving the movement. Let me walk you through the approved indications for the back brace use. So we suggest using the brace if you do have general acute and chronic pain in the target region. Once again, as mentioned, as a rehabilitation process for relaxation and recovery after physical exertion. Also for the recoveries after injuries and surgeries, and as I mentioned, as a preventative massage or pain-relieving support during the activity. Now about the contraindications. Even though the Acupressure Octopus braces are safe, non-invasive products, there are several important contraindications that apply to all models. First of all, the braces should not be used in cases of severe spinal injuries in the acute phase, or when there are active infections of the spine. In these situations, the body needs medical stabilization, not external stimulation. Secondly, the braces should not be worn in oncological diseases of the spine because any additional mechanical or circulatory stimulation might not be appropriate. Thirdly, the brace should not be applied on damaged skin. This includes inflammations, open wounds, abrasions, or skin irritation in the area of use. The acupressure elements create local pressure, which can worsen these conditions. Another important contraindication is acute abdominal pain, where external pressure or stimulation could increase the discomfort. Also, the brace is not recommended using during the pregnancy due to changes in the body, biomechanics, and the sensitivity. Additionally, patients with chronic obstructive pulmonary diseases should avoid using the brace, especially thoracic models, because they might affect the breathing mechanisms. And finally, the product must not be used by the children or individuals with cognitive or mental disorders, as they may not correctly understand the control of usage. And so actually, who are the people who use the Acupressure Octopus? Especially appreciated by the people with sedentary jobs, such as truck drivers, office workers, who sit most part of their day, which is very realistic, right? Also highly relevant for new mothers, especially in the postnatal period, providing support, comfort, and relaxation. Needless to say, the product is also very much appreciated and very well suited for active people, including builders, coaches, and others with physically demanding daily routines. Sports lovers use it after the trainings to reduce the muscle pain. Actually, by improving the local microcirculation, the lactic acid then stabilizes much better, easier, and all of the recovery process is happening much faster. And many professional athletes also use it after the hard trainings. And once again, it's equally important for people who are going through the rehabilitation process. Also, a large group of users are elderly people with chronic back pain who often experience a better comfort, improved mobility, and a higher quality of life, because essentially that's what all of us are going for and looking for and hoping for, right? And I am also here to talk about why the Acupressure Octopus is a valuable product for your business. Even with a 3-week money-back option, our customer success rate is quite high. It's more than 97%. So we're very happy with our healthy customers. We also have a strong word-of-mouth effect. We have repeated purchases from the same people for their family members, for their friends. So people are coming back and buying more of our braces. So our philosophy is a completely different, right? We are the opposite of the classical stiff back brace situation. Therefore, our product is unique. There is no such patented product on the market like ours. There is currently no directly comparable product to what we offer. Our pro-movement approach and the special acupressure elements is what makes us unique and different from other players on the market. Our orthoses, the back braces and the elbow, as well as the knee orthoses, come in a broad range of sizes, colors. They also come in a washable storage bag, and of course are made from the body-safe products and materials. It's also important to note that it is produced in compliance with the MDR requirements, and the back braces are a Class 1 medical device. All in all, it creates a strong growth potential in both medical and retail segments. Please get in touch with us if there are any questions that may have occurred after the presentation.